Hey, welcome to Shiver's channel, your ticket to the wonders of science. You've probably seen a lot of pink ribbons this month, and also many people from different fields, especially in medicine, encouraging early detection. But beyond these pink ribbons and campaigns, there is fascinating science to discover. Breast cancer is one of the most common cancers that affect women. It happens when cancerous cells in your breast multiply and become tumors. About 80% of breast cancer cases are invasive, meaning a tumor might spread from your breast to the other areas of your body. Breast cancers typically affect women aged 50 and older. It can also affect women who are younger than 50. Men also might develop breast cancer. Healthcare providers determine cancer types and subtypes. In this video, I will mention only types, so they can tailor treatment to be as effective as possible with fewest possible side effects. Common types breast cancer include self-infiltrating ductal carcinoma. This cancer starts in your milk ducts and spreads to nearby breast tissue, and it was said that is the most common breast cancer. Lobular breast cancer. This one starts in your milk-producing glands in your breast and often spreads to nearby breast tissues. And it was also said about this that he is the second most common breast cancer. Ductal carcinoma in situ, DCIS, like IDC. This breast cancer starts in your milk duct. The difference is DCIS doesn't spread beyond your milk ducts. Less common breast cancer types include triple negative breast cancer, TNBC. This type is rare. It accounts for 15% for all breast cancer cases. This invasive cancer is aggressive and spreads more quickly than other breast cancers. Inflammatory breast cancer, IBC, is a rare aggressive cancer. It affects the skin on your breast, and it happens when your cancer cells block your lymphatic vessels in your breast and causes inflammation that might change your breast skin color and appearance. Paget's disease of the breast. This one is also rare cancer that affects the skin of your nipples and might look like a rash. Did you know that breast cancer can show up in many different ways? For some women, the symptoms are clear and easy to notice. But for others, the change might seem small or look like just a normal difference in your breast. And sometimes there might be no symptoms at all in the early stages. But when signs do appear, pay close attention to them. A change in the size or shape of your breast, a small lump that feels as teeny as a pea, a thickened area in your breast or underarm that doesn't go away after your period, or change in the skin like dimpling, tightness, flaking, or redness. You might also notice the skin turning darker or more inflamed. Other possible signs include a firm marble-like area under your skin or discharge from your nipple, whether it's clear or blood-stained. Cancer begins in a place we cannot see with the naked eye, inside the nucleus of the cell, where the genetic materials, DNA, hold all the instructions that regulate the life of the cell. But sometimes a small error occurs in those instructions. This error known as generic mutation. A mutation is a change in the sequence of generic bases with specific genes. It can occur due to exposure to radiation, harmful chemical, or certain viruses that affect cell, and sometimes simplify as a natural mistake during cell division. Normally, the body has precise mechanisms to repair such errors, but when the repair systems fail, the damaged cell continues to function abnormally, triggering a chain of events that can eventually lead to the formation of tumor. Under normal conditions, cells divide only when the body needs new ones. Once the right number is reached, they stop dividing and undergo a process known as a programmed cell death or apoptosis when their job is done. However, when the genes that regulate this cycle become damaged, the balance is lost. Some growth promoting genes turn into oncogenes, which constantly push the cell to divide, while tumor suppressor genes, which normally stop cell division, become inactive. As a result, cells begin dividing uncontrollably and refuse to die when they should. Over time, the cells accumulate and form masses known as tumors. Eventually, cancerous cells might acquire the ability to invade surrounding tissues and even spread to distinct part of the body, a stage known as metastasis, the most dangerous phase of cancerous development. Early detection isn't just save lives, it transforms them. When breast cancer is found in its early stages, the chances of recovery are remarkably high, often over 90%. At this point, the tumor is usually small and localized, making treatment far more effective and less physically and emotionally demanding. That's why regular screening and self-awareness are so essential. Monthly self-exams and medical check-up, including mammograms, when recommended, are simple steps that can truly make the difference between a full recovery and a difficult journey. Awareness isn't about fear, it's about empowerment. It's about knowing your body, recovering changes, and taking action early. And always remember, the earlier it's found, the easier it's treated, and the higher the chance of complete recovery. Prevention begins with awareness, and awareness begins with you. In the end, science isn't just about understanding disease, it's about protecting life. Every cell in our body tells a story of survival, and your story can remain on of strength and hope if you give your health the attention it deserves. Remember, early detection is not just a test, it's a second chance and life. Spread awareness, speak up, and be the reason someone else gets to live there. اللهم إننا نسألك الشفاء جميع المرضى. Amen. Looks like we've come to the end of this journey. This is Walls Shivers, and you, my galaxies, make it brighter every time. Bye.